Good. So, ladies and gentlemen, welcome yet to another live on the Health and Wellness Spot. This is Dr. Lewis. It's a pleasure always having you here. Good morning, good afternoon, and good evening from wherever you're watching us from. As a norm, kindly confirm if our sound is okay so that we can kick this on a high note. And as you join in, kindly bring in a relative. Kindly also refer this live or share this live to uh, your pages so that most people join in, and through that we get to reach the masses, because we're going to talk about a deep topic again, that is called BPH. Most of you know it as benign prostatic hypertrophy. Sometimes it's also called benign prostatic hyperplasia. So it's interchangeable. Okay. So kindly, as you join in, let's roll this conversation and get to understand what is this. Is it preventable? Can we reverse it? So we hope you enjoy this live. Bring on board those questions so that we get to answer them. So let me bring in people on my YouTube channel so that we start as a team as always. Good. So I hope you started your week well. Those who joined in the fasting, we appreciate so much that you became part of us. The 48 hours fast was awesome. We ended it yesterday, and one of the reasons why we partake a 48-hour fast is because we want to boost our testosterone as men. We also want to boost our growth hormone uh, uh, as human beings, because the growth hormone is boosted when you fast, and a prolonged fast for that matter. I'm waiting for my people on YouTube to confirm that the sound is clearer on their end so that we can start this off. Meanwhile, let's close the gates also. Good. Joa Boboge on YouTube is kicking this up on a very high note and a very sad note, and is saying that BPH joined hands with diabetes to kill my father. He died on the bed waiting for prostate operation. This is a sad story, Joab. So we'll talk about it so that, again, I've seen some links being linked to genetics, and that prostate can be linked to genetics. And therefore, if your father died of the prostate, either prostate cancer or BPH, then chances of you getting these are also high. So we will discuss this and we will get through it. I hope after that you can change the lives of people around you. Thank you so much for joining in once again. And let's jump straight into it now. Before I start this, let me give you a little story, just a brief. Uh, Back in 2019, I had a relative, a very close relative, who was diabetic and obese. And in Kisumu, I don't want to mention the name of the hospital, there was a urologist that made a diagnosis of an enlarged prostate. And he did that by doing an ultrasound and also uh, some rectal examination, the digital rectal examination, and then some biopsies that were sent to South Africa so that they can be confirmed. And if he was uh, uh, already into cancer, they will start or initiate therapy or do a surgery. So now, the interesting part is, of course, as they pricked the rectum or the prostate to get the samples, they sold him some form of fear by telling him that once you prick this prostate, and if it's already cancerous, that basically means that these cells will multiply so fast, and chances of him surviving will be very minimal. So, of course, all of us were filled with fear, and having very limited information about the prostate, we we bought the fear. Then, of course, the samples were supposed to take about 2 weeks or so for them to come back. So you can imagine the worry that was coming as a result of that. Again, uh, we had another option that we can choose because, of course, there was only one direction now that we have to have a surgery. And the second option for this was to go to Jaramogi Oginga Odinga referral, and because of course the money was not uh, the pockets were not uh, as high as we would have loved it, because they were asking for 415,000 Kenya shillings. That is almost half a million for the surgery to be performed if at all those results come back. But what I didn't understand is, were those results coming back for the surgery to happen, or were they just coming back to be confirmed if it's either BPH or the prostate cancer? So the reality is, as we'll be heading through this video, you'll realize that BPH is not cancer and it doesn't have any link to cancer, the prostate cancer. So they are quite different, okay? But at that moment in time, of course, anything that was being sold to us would have bought it. So, of course, again, remember who was supposed to check this money? Of course, Daktari is here. He will do something. Okay. So now, the second option was to go to Jaramogi, and apparently, Jaramogi was booked. Remember, this is August, and Jaramogi was booked. The surgeries for the prostate were booked all the way to July 2020. Is it 2020? Yeah, I think so. Yeah. And then the same person who is actually running this clinic and doing this test, and the same urologist, is the one who is supposed to perform these surgeries at Jaramogi. So it became quite a struggle, because now he only had one option, because on his private practice, of course, he's available, but on public practice, he's booked until the following year in July. So that became a little worrying for my relative. And as the results came back, of course, it was confirmed it wasn't cancer. But the PSA that we were given, the results for PSA were high. They were at 17. And if you know anything about PSA, it's supposed to be below around zero point 0.4. So 17 was so high. So again, that was another way to buy the fear. Then I thought that this was a lot of money. And of course, we decided to hold back a little bit. And we just decided to go for data remodifications. And the rest is history. So that's how I managed to possibly save that junk, or that whooping load of money. However, that is not important for today. That was just to tell you that sometimes uh, most of these conditions can be a misdiagnosis, and some of these conditions can also be an appropriate diagnosis. But the way the system tells you fear basically tells you that you only have one option or two options, and one of the options is drugs, the other one is surgery. So that is a serious problem. So now, uh, I want to tell you that BPH is not cancer. So before I even proceed, I would like to just show you how the system behaves. And I want you to listen to this. I want you to just hear this definition of the prostate of BPH, okay? And I want you to know how sometimes the system messes up. By the way, we will use this information to also question the therapy of BPH, and if at all we really need the surgery, or how does surgery come in, and how does these drugs come in. So this is the definition: that benign prostatic hyperplasia, also called BPH, is a condition in men in which the prostate gland is enlarged and it's not cancerous. At that point, we are very clear. BPH is also called benign prostatic hypertrophy. So that is basically the definition. So when you hear these names, BPH, benign hypertrophy, and I see anytime I post anything on my socials about benign prostatic hyperplasia, somebody will come in and tell me, "No, I'm correcting you for this is not hyperplasia; it's hypertrophy." And these are just fancy medical terms to just tell you the prostate is enlarging, and it shouldn't be enlarging. But this is a natural process, because as people age, as you get to 30 and above, your testosterone levels start to go down by about 1% every year. And this is associated to a lot of issues. Most men know that as you get older, you grow fat. because you become more sedentary. You eat a lot of bad foods because the information is not yet there. It is not yet out there for the longest period of. Just a minute, somebody saying your sound is a little shaky. I guess so. So let me see. Let me see. Kindly, if the sound is clearer in my on my YouTube, just be quick to tell me so that I can know. I'll be patient for about a minute or so that this sound gets clearer, because I don't want it to be shaky, and we need to get this information clearly. So kindly just confirm if my sound is clearer and not shaky anymore. I'll appreciate. Okay. Good. Anyway, meanwhile, let me just proceed, and as they confirm, we shall know. People on TikTok can also confirm if my sound is clearer, so that we don't get into a mess. Okay. So anyhow, so as you get older, as you get into your 30s as a man, as you get into your 30s, there comes in a problem. Thank you so much, Cecilia, for confirming that the sound is clearer. Good. So as you age and as you get into your 30s, testosterone levels start to go down. And that's a natural process because it's an aging process. So they start to go down by about 1% every year. And by the time you're getting to 35, it's about 2%. However, the modern generation is messed up because the foods that we eat, the drinks that we take, the alcohols and stuff, the juices, the soda, all these are contributing to all health issues. We consume a lot of processed foods. We consume a lot of seed oils that are highly inflammatory to the system. We consume a lot of sugars, and all these are contributing to the decrease or decline in testosterone levels. But as a man, you know, testosterone is very important to you. Unlike women, where estrogen can start becoming a problem, testosterone is very important to a man, and that's why it should be protected by all means. Now, the reality is we are not protecting that hormone because most of us don't even go to the gym. And if we go to the gym, we are going to the gym for the ego. We are not going to the gym to do something that is essential, that is actually required. We're going to the gym to just for the ego and to show people that we are doing okay. So this is the point. So at 30, most men are even at 5% decline in testosterone. And guess what? This decline comes in every year. So as you age a year down the line, it's 1%, it's 2%, it's 5%, depending on how you're leading your life. And that is becoming a serious problem because as testosterone goes down, you start getting an increased estrogen in the system. Also, as testosterone goes down, and by the way, as you age, sometimes you can get the foods that we eat convert testosterone into another type of testosterone, actually an active metabolite that is called DHT. If most of you have heard about that, that is the dihydrotestosterone. This is not testosterone. This is a metabolite of testosterone. And this metabolite is actually dangerous. This is for the people who go to the gym and they use those testosterone booster shots. Those who are on testosterone supplements will bear witness. Sometimes when you start using these supplements, you end up having starting to lose hair. You end up starting to have problems as related to the prostate because these shots, this testosterone that you're loading into the system will now start being converted because again the body only uses 2% of uh, the the total amount of testosterone that you're loading into the system. So therefore, the rest will be converted by an enzyme that is called 5-alpha reductase. It will be converted to DHT, dihydrotestosterone, which is a dangerous one. This is the hormone that is responsible for baldness, men who have baldness. This is the hormone that is responsible for an enlarged prostate. So we will find out where it lies because there's hormonal, there's dietary, there's inflammation. So we'll find out about hormones. We'll talk deep about hormones as we go on with the live. Okay? So that's what exactly what is happening. So I'm glad that my sound is back on YouTube. And as I start, it should be a norm that we say hi to people who are joining in. Cecilia, welcome aboard. Lily K, Carol, Jerry, Fatuma Lee, Priska Anyangu, always a pleasure having you in. Miriam Kanyuira, Augustine Odindo, Joa Boboge, Washira Theuri, Engineer BG Mwangi, Muriwe Paul. Muriwe is from Uganda. I remember that name. Thank you for always joining in. Ari Naitwe Andrew. Wasike is in the building. Thank you so much for being part of us, Wasike. You've always been the man behind the cameras. There's another gentleman that you people don't know is called also Abdul Aziz Opinia, a very good gentleman behind the scenes. So we appreciate them for making sure that we are clearer and that our information is getting out there louder and clearer. Madiba Makori and Selina Kisienya, and finally Samuel Asoa. We actually celebrate all of you for coming in again to join us on this live. Keep doing that on Mondays, on Wednesdays, and on Fridays. And as usual, we never disappoint. Okay? So the prostate sits actually, you see, the prostate is a gland that actually produces some of the fluid that is supposed to help the sperm to come out during an ejaculation. So you realize that there's a tube that is coming all the way from the testicles, and there's another tube that is coming from the seminal vesicles, and they join in at the prostate level. Once they join in at the prostate level, the prostate surrounds the urethra, and you see every component that is coming from the bladder through the urethra has to go through the prostate. And again, everything that is coming from the testicles and from the seminal vesicles has to go through the prostate also. So therefore, the prostate plays a very important role. Now you see why it's important there, because it will regulate everything that is coming from the bladder. It will also regulate everything that is coming from the seminal vesicle, the anatomy of the prostate. If you Google that structure or that image of the prostate, you will see what I'm talking about. It actually sits below the bladder. So the bladder sits on top of the prostate. Now, the point comes in here. When you have the urethra going through the prostate, okay, it goes through the prostate. Now, when you have that prostate enlarging, it presses against the tube, which is the urethra. When it presses against that tube, then it starts to narrow. Now you start having problems with urination. And by the way, it's a normal process that the prostate will enlarge. The problem comes in when it enlarges more than it's supposed to, and now starts giving you these prostate symptoms. That's when the problem comes in. Okay, so all of us have an enlarged prostate. And by the way, as I go ahead, I want to pose a question to you. That thank you so much, Andrew Mutua, for coming in. I appreciate you, brother. So as I continue, let me ask you a question. Why do you think that most of the people who have an enlarged prostate have been told that they have high testosterone? If at all you have an enlarged prostate, you also know what I'm talking about. So why do you think these people are told that they have an enlarged prostate? Because of rising amounts of testosterone in the system. Yet, we have a lot of teenagers, and actually at puberty is when testosterone is highest. So we have these young boys who are running around with a lot of testosterone. They are so vibrant, they are so energetic. Why do you think that these gentlemen, these boys, don't have an enlarged prostate? Why do you think that's the case? So that's my question for you today. Why do you think teenagers don't have those enlarged prostates, yet older people beyond 40 are the ones who are coming up with all these enlarged prostates? Yet the system tells you that testosterone, high amounts of testosterone, is the problem in an enlarged prostate. So why do you think that's the problem? That's the cause. Why do you think they tell us that? So kindly answer that question, and I'll answer it after some time. We'll discuss the hormones. So I'll do that to you so that I can clear the air. Meanwhile, let's proceed. So we already said as you get to 30, you start to get a decline by 1% of testosterone. And it goes that way as you age. So you can imagine by the time you are 50, if at all you've not been boosting your testosterone through the gym, through basking and sunning your balls, through cold showers, through runs, through eating healthy, the saturated fats, the meats, and the fatty meats, you can imagine how you'll end up at 60 with a lot of muscle wasting, with low energy, low motivation, and even depression, because this is a hormone that pumps men into doing things that are different. It's a competitive hormone. So therefore, if it goes down and below, you will end up getting depressed. And most of the people are getting depressed because of this hormone. Now, apparently, most men who have bald heads also go for testosterone shots, hoping that testosterone shots will boost their hair growth. But unfortunately, that shot of testosterone that you're getting, similarly to the guy who is in the gym and trying to get muscles by using what do you call it, the testosterone shots, you people are in the same WhatsApp group. So what will happen is all of you will end up getting baldness, even more baldness, because that testosterone that you're loading into the system simply is going to be converted to DHT, and DHT is the one that will make you even more bald, and then you end up getting again an enlarged prostate. So why would you walk one step ahead and then walk 3 steps behind. It's a waste of time. So go to the gym, lift progressively, eat healthy keto and the proteins, and then start fasting so that you can fix your system at large. Okay? So that's an intro for you. And as we go deeper into it, I want you to understand that the only time that this enlarged prostate calls for alert or alarm is when it's too big and you start experiencing those symptoms. And what are the symptoms of an enlarged prostate? Now, number one is what we call nocturia. Okay, nocturia is basically when you hear nocturnal, that's night. Uria is urine. So that means during the night, as you want to go and sleep or as you're sleeping, you have the urge to go to the toilet more than twice. You run to the toilet, come back. You go to the toilet again. So you have disrupted sleep because of those trips to the toilet. Okay, the voice is cutting. Adjust the mic up a bit. Okay, thank you, Isaac. I don't know what's happening to us today. Last time it was clear, and today is becoming a serious problem. But again, we will not give up. We'll keep on going. So I hope it gets clearer as we continue. Good. So those trips that you're going towards the toilet, and most of you will confuse it with diabetes. Now, fortunately, the chances are high that somebody who has diabetes, of course, they might end up getting an enlarged prostate also, because we'll talk about hormonal problems that come in to cause an enlarged prostate, and one of it is insulin. So we'll talk about that. But for now, let's continue. So that's one symptom of it. And then you also, some people will tell me that, going to the flu, by the way, most of you who get diagnosed of this prostate enlargement, most of you don't even realize it. You get all these symptoms of the prostate apart from just a difficulty in passing urine. So you get all other symptoms that we'll talk about. And then when you go to the toilet all the time, at night, you're headed to the toilet, you might end up thinking that you're okay because you take water. I drink a lot of, doctor, I drink a lot of water at night. So when I go to the toilet, there's no problem. It's just because I drink a lot of water. Then I ask you a question, do you add a pinch of salt in your drinking water? You're like, no, I don't. But I guess it's because of this water. So you're blaming something and not realizing the intensity of what is actually happening. And by the way, this is the same thing. That same ignorance that you ignore these minor symptoms is the same case that happens with the doctors. I wish doctors would take much time to do physical examination, to just do a general physical checkup to this patient. And by the way, you do know that most of the conditions you can diagnose them from a physical examination of this patient. If you just take keen on examining these patients physically and doing an appropriate check as it's supposed to be done, then definitely all these conditions will be treated easily because there will be no misdiagnosis. There will be no inappropriate cases that are actually being forwarded to the lab for useless laboratory tests that don't even make sense. Things like H. pylori and ulcers, you actually diagnose them from asking these patients what they've been eating. Things like blood sugars, you'll actually see the symptoms, and by the time you're forwarding them to the laboratory, you already have a rough idea of what is going to come back from the laboratory. But most of us want to rely, just want to talk at petition to line. Patient should go, pass and forward, pass and forward. Patient comes in, you take about 2 minutes, they are gone. So that you serve a large population of the patients so that they think you're doing a good work or you're actually the active one. But the reality is, you're not doing anything. You're not doing any justice by just forwarding patients to the lab. Then they come back, you just check the results, and you're busy writing antibiotics and stuff. It is unfair to the patient. Patients deserve adequate history taking and also physical examination. Through that, you can easily diagnose any condition as fast as possible. Okay. So number two, a symptom that you'll experience is hesitant urine. So you go to the toilet, yes, you're going frequently to the toilet, but when you get there, you try to pass it out. You have the urge to push it. Most of you know what I'm talking about. When you're trying to push urine, by the way, when you're a young boy, you just went out and pulled out your penis and then urine comes out. But as you age, you realize you have to hold your breath for you to take out the urine. Like, that sound, right? So you have to push it because it's hesitating. So that's another symptom of prostate. And then we have weak stream of urine. So the younger you are, the sound of urine that comes out and goes further, you shoot further and it has a lot of pressure. But as you age, you realize it starts coming nearer the body and it becomes a weak stream of urine. That's another symptom of an enlarging prostate. So once you start seeing these symptoms, it's only fair that you see your doctor so that you get adequate diagnosis or Medicare. Okay. Of course, I always prefer medicines to be the last a form of therapy and the surgeries. But when you see these symptoms, it already tells you there's something amiss or amiss. Therefore, you need to see healthcare. And then some will get decreased ejaculation. So you have, and this can be also one symptom of infertility, because you're trying to get somebody pregnant, but your ejaculation is very minimal. And sometimes, as you try to ejaculate, there's some pain. Even when you pass urine, there's some burning sensation and also pain during ejaculation and urination. So those are just some of the symptoms. Again, another one is, of course, trouble in holding urine. So you try to hold urine and pop, we are done. You're over before you even started. Okay. And then incontinence and incomplete emptying of the bladder. So when you go to urinate, you pass that urine, all it's easy, but you have this urge that I did not urinate completely. So there's still some volume of urine remaining in your bladder. And then then afterwards, you can also get bloody urine, because when you have an inflamed prostate and when you have infections getting into it, the bladder infections and the urethra infections, even the prostate inflammation can get you a bloody urine. So when you get this, it's high time that you run to your doctor and get an examination, get that ultrasound done, get that PSA taken. And this is for people who are above 40. If you experience these symptoms when you're above 40, then this has to be a call for alarm. Of course, a teenager at 19 and below, it's hard for them to experience such symptoms unless it's an infection. But for them to experience symptoms related to the prostate is very rare. But as you get these symptoms, kindly rush to the doctor and get your PSA, your ultrasound, and your rectal examination done, so that we can rule out an enlarging prostate. Okay, so that is how it is. So I asked a question, that why do you think that teenagers don't have enlarged prostates, yet they're the ones that have a lot of testosterone, and yet the system tells you that high levels or amounts of testosterone are the ones that are responsible for you having an enlarged prostate. So do you think that's a true statement or a false statement? Do you think high amounts of testosterone in the system are responsible for an enlarged prostate? Do you think so? So as I do that, as I get that answer from you people, allow me to keep on. Yeah, I guess my sound is now clear. Thank you so much. Good. Thank you. Thank you. Good. So most of these symptoms, as you just heard me mention them, you realize they are cleanly or closely related to diabetic symptoms, type 2 for that matter. So they are related. So now you might end up confusing between the two. And even your doctor might end up confusing and take you to possibly do a blood sugar test, and you're diagnosed with diabetes. Unfortunately, now the focus shifts from the prostate all the way to diabetes. And now you start medications for diabetes, which definitely treat the symptoms and don't treat the disease, instead of focusing on the major point. But as you do that, as you take in those diabetes drugs, you are actually allowing the prostate to keep on enlarging and cause you more problems. And by the time it's diagnosed, it is severe, and therefore we have either a laser has to be done, or now a surgery has to be done, because even the drugs for treatment of the prostate are only trying to fix the symptoms and not trying to fix the disease. And that's what we're supposed to run away from. So what is causing this enlarged prostate? What do you think is the cause of this enlarged prostate? Because the reality is, if we have an organ misbehaving, what is the cause? Because if we know the cause, it is easier for us to target it and clear the cause. Once we clear the cause, we don't need to focus on treating the symptoms. The symptoms just disappear. But the problem with our healthcare systems, for these chronic conditions, they are always focusing on the symptoms. Diabetes treatment is symptomatic. They are focusing on treating the symptoms. Hyperglycemia. Hypertension, they are focusing on treating the symptoms, enlarging the blood vessel, or opening up the blood vessels. Heart disease, the same. Kidney disease, the same. Prostate disease, the same. Even prostate cancer, the same. So we are always focusing on treating the symptoms instead of focusing on treating the disease. And that is becoming a serious problem. Because this is not this is exactly what I always want to understand. Why is it that the mode of actions of these drugs are always targeting the symptoms? For example, in diabetes, we talked about it several times here. How is it possible that you can use drugs that pump high blood sugars into the cells that are already full? Because diabetes is not in blood. That is a symptom. Diabetes is basically in the cells, the fat cells, the liver cells and the muscle cells. It is not being utilized enough, and therefore even the cells don't want it anymore. But you're pumping this from the blood into these cells. For what reason? And then we start wondering, why do you have an enlarged prostate? Why do you have your leg being cut off because of that ulcer that doesn't heal? Why do you have your eye getting to blindness? Why do you have your brain getting rot? So you lose memory, you get Alzheimer's. Why do you have all these nerves getting numb, and therefore this person has all this numbness, the peripheral neuropathy? Why do we still go for dialysis? So why are we treating diabetes when we will still end up getting to dialysis anyway? Because diabetes kills the kidneys, and therefore you'll need a dialysis. So why are we focusing on treating symptoms of diabetes where the disease establishes itself? And yet there's a lot of money that is pumped in research for these chronic conditions. There's a lot of resources. There's a lot of studies that are coming out. And the same studies have never found a reason to treat the cause. All of them have always found a reason to treat the symptoms. So what is really causing an enlarged prostate? Because as you age, what is really causing this enlarged prostate? Because once we know what is causing an enlarged prostate, it is easy for us. And by the way, if not me, it's you, of course. One of your relatives has suffered this condition. So therefore, it will be mean if you don't share this information to them. Come on these lives, learn something and share it widely. It will not hurt you a bit. These diseases, these chronic diseases, we are putting much focus on these chronic diseases because they are businesses to some people, and therefore greed comes in. For example, if you have malaria, you go to hospital, you're tested, and you turn positive for malaria, you're given a drug that will kill Plasmodium, and malaria disappears. But come to think of it, that you're there treating a headache, the symptom of malaria, but leaving the Plasmodium to multiply and just kill you. But they know that this will take a shortest period of time. So therefore, you will not need to give them more money, because you see, for malaria, it takes about a month and you're gone. Even a month is too much. So therefore, they cannot extract as much money from you as possible. But for the chronic conditions, they are assured that they will have you for a lifetime. They're sure by the time they're done with you, by the time you're going to that grave, they have extracted as much money from you as possible. Come to think of it, that relative of mine was obese. That would have been one of the reasons, or one of the things that this doctor would have pointed out, this urologist. Number two, he was diabetic and hypertensive. Number three, now we have a high rising amount of PSA in blood, which indicates, of course, there's a problem with the prostate. But of course, he's a urologist. He doesn't care about the diabetes. He just wants to care about this prostate and how it will be removed so that you can chuck the 500,000. That's it. And I tend to think that's the reason why most doctors are living a very miserable life, even though they earn a lot of money. This is because they focus on the wrong things. And every student, as they get into a medical school, they are always having this zeal to change lives. They always want to change lives. They have that passion in them. There's a burning desire inside them that they'll change lives. Oh my goodness. Wait until they start getting into the clinical aspects of it, and they start getting that false ego. They start putting on a stethoscope on their neck and the lab coat and going into the morgues to do the anatomy classes. Now they become superhumans, that they know your body more than you do. And now they can instruct you anything. They can tell you to take a gallon of water in the morning and in the evening, and you'll do it faithfully. And now, of course, the big pharma comes in through the medical representatives who are selling these drugs, and they give them bribes. And they tell them, don't let this drug sit here. Just push this drug for me. Push this drug for me. When do you think that things will ever change for the better? Of course, they will not. It's up to you to get this information and use it to help you and help people around you so that you can save healthcare costs. And if you have a healthy insurance, if you have a private insurance that is deep, man, you're a target of most of these doctors. They know what they're doing. Visit those hospitals, those private hospitals. See your doctor coming from a surgery room, 8 hours of surgery. He's super tired and his glucose are very low. And guess what the secretary is doing? Mixing sugar or glucose in water to give him so that his blood glucose go up and it stabilizes for him to see more patients. So your doctor is already diabetic and he's just performed a diabetic surgery or a prostate surgery. and he's actually telling you that this is irreversible. We only need to manage the symptoms. And here, the only option is surgery, and the only option is medicines. So let me tell you something about. No, let me reserve that until I get to the drugs, so that I can talk about a drug called finasteride that is used for prostate enlargement. Because again, here we use the mode of action of drugs to question the therapy. We use your doctor to question his modes of treatment. We use the syllabus to question the same syllabus. And most of you are so you have a lot of time, you are idle, you have internet, but you never take a single minute to just research or read about medical stuff. Listen, there's no other wealth that is not health. Health is the leading wealth. Therefore, take it serious. Take it serious. You don't need me to come here and tell you what you need to do, because I might be wrong also. What you need is you need to read on your own, get what is challenging and what you don't understand, and then ask on lives like this. Anybody who is preaching health information, be curious about them. Even though I know on the internet, most of us are preaching different things and it gets confusing. I can preach here about low testosterone being the problem here, and then tomorrow somebody is here giving you other research and other studies that are proving high testosterone is the problem, and then you get confused. But we went through the same medical schools, we went through the same pharmacy schools. Just like engineers, one makes a very good building in Dubai, another one makes a very bad building in Kenya, and it collapses and kills people. But they're the same engineers who did the same things. Anyway, let's continue. So, what causes an enlarged prostate? Number one on the list is aging, of course. As you age, your hormone testosterone starts to deplete, starts to diminish. So that's normal, that's natural. But you can do something to boost this testosterone apart from getting the shots. And if you have very low testosterone in your system, it's okay, you can have the shots for testosterone, but actually talk to your doctor and do it and get it from somebody who is qualified. Don't do it just like women do it all the time from time to time when they do the liposuctions and the bariatric surgeries. Women can get crazy a little bit. They can get it from anywhere as long as they have the resources. So if you're a man and you have these problems, if you have low testosterone, your doctor tells you have very minimal testosterone, go for the testosterone shot. I'm not against it. But get it from somebody who understands what they are doing, because the reality is the more you get this testosterone into your system, the more you'll start getting it converted into DHT. And that's a very dangerous one, a very dangerous metabolite for testosterone. So aging, of course, reduces testosterone, and that starts to bring problems in elderly people. Every elderly person will tell you their sex drive is going down, their ability to perform functions and tasks is getting lower, and they don't have this motivation, of course, because of low testosterone, and that's normal during aging. But the good thing is you can do something about it, like cold showers, like walks, like runs, like the gym, heavy lifting, like eating healthy diets, like fasting, like sunning your balls, like walking barefoot, just to release the tension in your system, like sleeping. All these are things that can actually boost your testosterone. They're natural and they are free. You don't need anything to pay to just bask or sun your balls. You don't. You don't need anything to pay to just walk barefoot. You don't need to pay anything to take a cold shower, do you? But at least you'll pay a dime to take a hot shower. Number two on the list is hormones. Now, this is where most of us fall. And actually, the number one reason also falls under this. So, testosterone going down falls under this because there are about 4 hormones that are involved in enlarged prostate. Number one. So, actually, as we talk about this, simply note down that these are the causes of an enlarged prostate. And as you note that down, you can easily now start to know how to reverse it. So, hormone number one is definitely testosterone. As testosterone goes down, you get into trouble. Because in relationship to estrogen, when testosterone goes down, estrogen goes up. And estrogen is a hormone that is actually a building hormone. So at least now you know that's hormone number 2, estrogen. Let me just correct this. So that is hormone number 3. So number 2, sorry. So we have testosterone going down, and now we have estrogen going up. And as we have estrogen going up, guess what else is going up? Because there are hormones that are totally related. Your thyroid hormones are going down because of estrogen. So it's like a holistic approach here. The thyroid is having problems. Your gonads are having problems because estrogen is going up and testosterone is going down. Now, again, another one. This testosterone is being converted actively into DHT, the hydrotestosterone. And then now we have the major elephant in the house, which is insulin. Most of you did not know that. Insulin is a hormone that is directly involved in prostate problems. There is a receptor in the gonads that is actually called IGF-1. That hormone binds insulin. And once it binds insulin, it does cause you an enlarged prostate. It causes overmultiplication of prostate cells and an overgrowth of the prostate, so it starts to enlarge. So let me read you this question from Andrew Mutua. Would you say the heavy specialization in the medical sector is also contributing factor? Let me clear the air on that one, Andrew. The reality is, I think also in the medical field, the higher you go, the more stupid you become because you narrow yourself to one thing, and that is a serious problem. And sorry to say this to these people who have attained higher levels in education, in health and in health sector. But the reality is, as you attain higher levels, the major motivation here is the money. Is not anything. The money and the status. It has nothing to do with changing lives. Because at the end of the day, the same people who are on top, look at how COVID did. The same professors and experts who are actually setting rules for you are the same who died later on with diabetes and all these COVIDs. So they have all these papers, and these papers are just to actually help them have some form of stand. It's the same way, like a diploma holder is one who plays a major role on the surface, on the ground. Degree holders and master's holders are busy in the offices. They can't change lives. And these people who are at the diploma level or the certificate level are the ones who learn a lot of things within a short period of time. The others do it in bits for the longest period of time. So the only difference is what they're learning in this long period of time. But this other one has accumulated all this information within the shortest period of time. And that's why people who are actually who have diplomas in pharmacy, diploma in clinical medicine, and all these nurses, these are people who are actually supposed to be respected, and they don't get the respect they deserve. These are people who are supposed to be used in research because they're on the ground. They are always with the patient. Look at hospitals. The medical officers are always waiting for a CS to jump on because of the allowances. But they're not doing anything. They're waiting for their day for consultation. They're waiting for their day to just jump in on a CS. Apart from that, nothing else. And they're busy arguing that they're better than the clinical officers. So even getting into an argument that an MO is better than a nurse is better than who, and a pharmacist is better than who. This is not a doctor and this is a doctor. But all these people are there. A hospital is a unit that has all these people to just change the life of one person, who is the patient or the client. But now they are busy arguing about the status. So yes, the higher they go, the worse it becomes. Because now they are consultants. So you can imagine. So this is not a head statement, but this is a reality. Reality on the ground is a consultant has possibly 4 days in a hospital in a month, and the rest of the month is running his clinic, and he's in his clinic is busy picking money from people in the name of consultation fee, which is just okay, possibly. But I hope one day we will get to be honest about things on the ground. So hormone number 1 is low testosterone. Hormone number 2 is high estrogen. Hormone number 3 is high insulin. And where are we getting this insulin from? Of course, the diets. The carbohydrates diet that we keep on feeding on the processed foods. That's where we're getting our insulin from. The only macronutrient that is not causing you a spike in insulin is fats, the saturated fats. How amazing is that? So when I tell you to eat fatty meats, you start ignoring, fats will clog my arteries. You are misinformed because dietary fats cannot clog your arteries. What actually causes clogging of arteries is the sugar, and we talked about that. As you lower your testosterone, you increase your estrogen. As you increase your estrogen, you increase your insulin as you eat those bad foods. And by the way, also lean protein. And you know the system has told you about lean protein. Eat lean protein because they are healthy. But lean protein, the body does not know how to store protein and amino acids. Excess of them, it doesn't know how to store. After you have rebuilt your muscles, rebuild your body structures, made amino acid hormones, and then excess of this amino acid is now has to be converted into glucose to be stored because the liver does not know how to store protein. Discards it, but for it to save it for the better day or the worst day, now it has to convert it into glucose, and then that glucose is stored as fat. So the more you eat that protein, you can get predisposed to high insulin and diabetes. So continue eating lean protein. If you're diabetic, you'll keep on being diabetic. But when I tell you to eat fatty meat, the exact point behind it is fatty meat has fats, essential fats, and those essential fats will not allow you to overeat that protein. This happens exactly also to eggs. They are rich in fats and protein. So these proteins, you cannot overeat them. That's why when you eat a boiled egg, you get bored so fast because of the fat in it. You get the point? So you cannot overeat it. But you go eat that nyam chom that is lean, you will eat a lot of it. And problems will start from there. So again, I repeat, on the hormonal part, number one, we said aging because of low testosterone. Number two, we said hormones. And number one is low testosterone, high estrogen, high insulin, and high DHT, dihydrotestosterone. Remember, that is coming from testosterone. Because the reality is, testosterone can only be utilized by the body to 2%. 2% of the total testosterone in your system is the one that the body uses. But the rest has to be converted to DHT. That's an active metabolite that will actually bring you baldness, will bring you an enlarged prostate, and therefore prostatic symptoms will start to ensue. Now, there's an enzyme that actively transforms testosterone to DHT. That is where the mode of action of drugs for an enlarged prostate come in. The drug like is called the finasteride. There's a drug called finasteride. And if you have an enlarged prostate, you already know that drug. Finasteride, which is a 5-alpha reductase inhibitor. So it inhibits that enzyme called 5-alpha reductase. And the function of this 5-alpha reductase is to convert testosterone into DHT. Okay? So this drug comes in and blocks this enzyme. Therefore, testosterone level starts to rise as DHT levels go down. That's the mode of action of that drug. So after those hormones as number 2 cause of an enlarged prostate, we have number 3 cause of an enlarged prostate, which is inflammation of the prostate. And where are we getting inflammation? Just remember this, that most chronic conditions occur as a result of systemic inflammation. Look at asthma. Asthma is systemic inflammation and autoimmune. Look at arthritis, inflammation. Look at diabetes, inflammation. Look at heart attack, inflammation of blood vessels. Look at Alzheimer's, loss of memory, inflammation of the brain cells. Look at numbness, inflammation of the nerve cells. Look at the kidney problem, inflammation of nephrons. Look at skin problems, inflammation of the gut. So this is inflammation. Inflammation is a problem in our system. And where are we getting this inflammation from? Seed oils, wheat products, sugar, processed foods. Anything that is taken to the industry for processing and then brought back to you is a waste of your time. Is a product, is not food. Go back to nature. So if you know the cardinal signs of inflammation, you already know that one of it is enlarging or swelling. So we have the redness, we have the swelling, we have the increase in temperature. All these are cardinal signs of inflammation. Therefore, if you have an inflamed prostate, of course, it starts to swell. And since there's a tube, the urethra that is going through the prostate, when it swells, it forces the pressure on the urethra and then it starts to close. And as it closes, you'll have difficulty in urination. You'll have painful ejaculation. Okay? So inflammation is a major one here. And this is where we talk about dietary modifications. This is where we talk about lifestyle changes. This is where we talk about anti-inflammatory drugs. However, anti-inflammatory drugs, the NSAIDs, non-steroidal anti-inflammatory drugs, are supposed to be used selectively and within a short period of time. Why? Those diclofenacs that you chop, those brufens that you chop, that meloxicam, that aceclofenac, that celecoxib that you keep on taking because you have back pains, because you have knee pains, because you have arthritis, and your doctor told you to take this for a month or so. These drugs hurt your kidneys. They reduce renal perfusion. So blood flow towards the kidneys is reduced. And what will happen is hypertension is coming in, kidney problem is coming in, anemia is coming in, vitamin D deficiency is coming in. So imagine how a single drug can actually mess up your system. And then they are also involved in messing up your gut. So therefore, ulcers is coming in. Therefore, gastritis is coming in. Therefore, a reflux disease is coming in. Then the final one on the list is oxidative stress. Of course, oxidative stress is happening in the mitochondria, is happening in the cell at large, and then the system at large. This is where you are accumulating all these toxins in your system. You're accumulating all these chemicals. You're accumulating all this estrogen. Where are you getting these chemicals from? Those deodorants, those perfumes, those body lotions, those commercial toothpastes, the GMO foods, the fertilizers, the herbicides and pesticides. All these are bringing in all the estrogen and all inflammatory toxins. And we said the cell only operates under two categories. One is where you're loading it with toxins, therefore you're inhibiting its action. And two, this cell is being loaded with nutrients. Therefore, prefer loading the system with nutrients, overloading it with toxins. But walk into a supermarket even without a budget of buying anything, you will end up buying something because the foods there are marketed adequately and appropriately to get you confused. Mickey is asking, why is BPH confused to be cancer? Yet from the word itself, benign is not always cancerous. It's not, don't even say it's not always. Benign is not cancer. Benign just means it is localized. It's there. Cancer means a spreading. So metastatic. Prostate cancer is a different type of story, and we'll talk about it someday. But prostate enlargement is not cancer. Most people think it's cancer actually, and it's because of the healthcare provider. And how many of your doctors get to define to you those conditions that you're suffering from? For example, the diabetes menace. If you're suffering from diabetes, how many of you even know what diabetes is? Doctors don't tell you. They just tell you you're diabetic and therefore you need lifestyle modifications. They don't tell you what lifestyle modification. They also tell you now you have to take drugs because the condition has to be managed. They don't tell you to be treated. And that's just them regurgitating the syllabus. After the syllabus, nothing more. So on oxidative stress, that's the reason why we ask you actually to fast, to eat healthy keto and the carnivore diets. Because once you fast, autophagy cleans the cell, relieves the cell from oxidative stress. And that's what you need as an individual. You need fasting to get high testosterone. You need fasting to lower estrogen and stabilize your hormones. You need sleep. You need fasting to cleanse the cells so that you recover from this. You need fasting to lose fat because, again, fat is highly estrogenic. So fat converts your testosterone all the way to estrogen. So you can imagine if you're a man and you don't fast, you are busy complaining because emotions are also because of estrogen. So every man should start fasting, be it an OMAD, be it a TUMAD, be it a prolonged periodic fast. You should be involved in fasting. It is the highest form of discipline that you can do as a man. It is not initiated by me. No, it's not. So don't think that somebody who tells you to fast is your enemy. He's not telling you to starve just because you have a salary. No. I know most people, when you get some few coins here and there, you become you become a food addict. And it's hard for somebody to get you off food addiction. So let me take you back to where we started on the definition of the prostate. Let me take you to the management of prostate disease. And by the way, there is something that that intrigued me on this is a research actually. And what causes benign prostatic hyperplasia? And the answer was the cause of benign prostatic hyperplasia is not well understood. Let's take a minute and just take that in. That the cause of benign prostatic hyperplasia is not well understood. But why are you treating it? So, what are you treating? So, you're quick to write me a prescription for finasteride, for prazosin, and damsulosine, but you don't know what is causing it. So, why are you writing that prescription? How will you even treat it? Why are you treating what you don't know? So, this is what they say. The cause of BPH is not well understood. However, it occurs mainly in older men. Just listen to that. BPH does not develop in men whose testicles were removed before puberty. That's just amazing. And for those of you who perform vasectomy, this is a red flag for you. Don't castrate yourself. Never castrate yourself if at all you want to recover from this. So let me take you to the drugs for just so that you can just have a rough idea of what happens in the system. Let me get here. Let me get it. So at least for the medical test, they've told us you can do a urinalysis, a prostate PSA, and then cytoscopy, of course, then an ultrasound biopsy. That is very true. And then they go ahead and tell us about the management, how to treat it. They tell us number one on the list is medications, and then they follow it up with lifestyle changes, and then they follow it up with minimally invasive procedures, and then surgery. Those are the 4 ways of managing it. And then now the interest to me is on the medication side. So I just want you to be very keen when I'm talking about the medication side. So I want you to hear what the system actually put across when they were talking about how to manage this condition. And when you start thinking deeper on these matters, you start to understand maybe we are the fools, maybe we are the stupid ones. So on medications, we have alpha blockers. Alpha blockers are drugs that actually block the alpha receptors. And when they do that, they cause dilation of the urethra and relaxation of the muscles of the bladder and also the muscles of the prostate, so that you can pass urine. And then they tell you phosphodiesterase 5 inhibitors. Then they tell you 5 alpha reductase inhibitors, and then combination medications. I have no problem with that. I have a specific interest in 5 alpha reductase inhibitors. So among the alpha blockers, of course, we have terazosin. They have labeled them there: terazosin, doxazosin. We have the tamsulosin that is actually mostly used, tamsulosin, the 0.4. Then we'll have alfuzosin, and then if you didn't think it in about the phosphodiesterase 5 inhibitors, this is where Viagra falls. And tadalafil. Viagra is called sildenafil. So we have another group of another drug that is called tadalafil. They fall in this category of drugs. Okay. And then we have 5 alpha reductase inhibitors, which number 1 on the list is finasteride and dutasteride. So the finasteride is the one that is commonly used, and maybe most of you have come across it. So one thing they said about this finasteride, they said you will need about 6 months for you to get the first relief from symptoms. So if somebody tells you to start eating healthy diets for about 3 months and start fasting instantly, you will complain so much and run to take the drugs that are actually going to take you 6 months for you to see the first relief of symptoms. Right? Why are we so fond of quick fix? Why? Why do we love quick fix? A drug that is going to take you 6 months or so to see the first disappearance of symptoms. So that's the reason why, anyway, they start by giving you tamsulosin to just relax your muscles, and then you get that ease passage of urine. Of course, that's an emergency drug, so which is basically okay. But you see, They will actually tell you that these drugs are supposed to be taken for a lifetime. So that's how they start. They tell you, this disease you only need to manage, and you see because of genetics and also other factors which they don't mention, you need to take these drugs for a lifetime. And actually, that tamsulosin, not tamsulosin, the finasteride, they still say that that drug will only be effective as long as you're still taking it. So they're telling you, come on, bro, you have to be this slave here for the lifetime. You will not recover. We are here to make sure that you will be here. So our role is to make sure that you will be here again. So if you already know that the cause is in inflammation, drop inflammatory foods, the seed oils, the wheat products, and the sugar. It's that simple. Inflammation disappears, so swelling disappears. And the best part about this is as you drop those inflammatory foods, you're also going to lower your levels of insulin. As you drop the industrial processed foods and carbohydrates, as you drop the wheat products, as you drop the sugars, of course, insulin starts to go down because if you have high insulin in the system, what it tells you is you are in a storage mode. You keep on storing, you keep on growing everything. Every organ keeps on growing. Your fat cells keep on growing bigger, you become fat. Your liver cells keep on growing bigger, you have a fatty liver. You have all these problems. Your process starts to enlarge. So what do? Reverse insulin resistance or hyperinsulinemia. And how do you do that? A zero carbohydrate diet, and then start fasting to burn the sugar that you already have in the system that is causing you insulin resistance. That's the easiest way to do it. So kill the inflammation, kill the swelling. So how is that to do? If you have inflammation, just get rid of it. That's it. It's that easy. If the only thing we cannot change here is aging, but we can reduce the level or the speed or the pace under which cells are aging by fasting, by eating healthy keto and feeding these cells with targeted supplementation. Okay. So if you have low testosterone, what do? Go to the gym, start lifting weights, keep running, take cold showers, sun your balls. Okay. Eat healthy keto and fatty meats. Drop the inflammatory foods that are causing you low testosterone. Almost runs down to the same things, but we keep ignoring because, of course, we can afford this unhealthy foods. And when you buy those unhealthy foods, there's some status that comes with it. If you have high estrogen, what do? Work on raising testosterone in relation to estrogen. How do you do that? Same things. Drop inflammatory foods, drop the sugars because sugars are detrimental to testosterone. What is targeted supplementation? Go for the supplements that have zinc, that have vitamin E, that have vitamin D. And what are these? The sun will activate vitamin D. But this vitamin D has to come from cholesterol rich food. So eat eggs, eat fatty meats, eat saturated fats, the ghee, the tallow, the coconut oil. Use lime or lemon water plus apple cider vinegar to reverse insulin resistance so that you can lower your insulin levels. So take that in the morning before you leave the house. Don't take morning breakfast. Push it towards midday. That's a form of fasting. In the morning, just take your lemon water, add in some 2 bottle tops of SCV, and see how you reverse your insulin resistance. Ain't that amazing? Do you need a drug for every condition that you're going through? No, you don't. You need dietary modification because what you're eating is what you become. So why would you focus? Because you've been scared. I have this enlarged prostate. I can't urinate. Now I have to take drugs for a lifetime. No, you don't have to take drugs for a lifetime. What you need is somebody to advise you about food. And when you start eating healthy foods, your prostate starts to shrink and the rest becomes history. And now you can save money to invest in something else. Medical bills are very expensive. You can imagine one surgery that will take about even 2 hours or even lesser, takes you 415,000 shillings. And of course, somebody who has the best insurance will take it. Quick, fast, minus slow. So it's not hard to treat most of these dietary conditions. It's not even hard to treat most of these chronic conditions. It's not. So the challenge with our healthcare systems It's just always, instead of focusing on treating the cause, they will always focus on treating the symptoms. And that's why that's why we get to rub shoulders with most of the people. Most pharmacists have remained to be a 2x3 pharmacist. You can imagine a pharmacist on the window, always 2x3, 2x3, packing and forwarding. You can imagine a dentist always just there to just extract teeth. That's the only job he can do. And now those people you rely on so much, the medical officers, the MOs, you rely on them to do these things, and they're busy seated in the offices waiting for a CS to jump on, to compete, waiting for that politics in the system. Can't we do better? The healthcare system was designed to be a team, work as a team. Everybody knows something. A pharmacist knows drugs better than somebody else. Medical officer knows all this diagnosis and all this stuff more than anybody else. We appreciate that. But you cannot live alone. You cannot survive on your own in a medical system. The title doctor is not enough. The stethoscope on your neck is not enough. The lab coat is not enough. The office and the prestige is not enough. That consultation room that you're having is not enough. If you've not focused on changing lives of people, and that's why we say in this channel, we glorify God by actually easing pain and suffering from the lives of his people. That's the only role that we know. We derive purpose in the glorification of God by easing pain and suffering from the lives of his people. And once that happens, when that person comes back and says, "Thank you, Daktari," that is not our glory, that is his glory. But until that is understood, it will always be about the money. Good. So let me go to the questions as I wind up. If you have any question, post it on my platforms and my comment section. I'll be easy to respond. I hope somebody who is moderating my TikTok can also pass those questions to me so that I can answer them. And that is how we do it. That's how we close it down for the prostate enlargement. So don't worry about enlarged prostate. It happens to everybody. Just the same way kidney stones happen to everybody. Just the same way gallbladder, the gallstones happen to everybody, but they get out of the system. If you have gallstones, you need to fast. You need to eat those saturated fats so that you get the cholesterol, and this cholesterol and will form the bile salts. Then the bile salts will digest this the gallstones. That's it. If you have kidney stones, simply eat lemon. You get the citrus acid, the citric acid. Simply fast. Simply hydrate with water plus salt. Stop eating those inflammatory foods, the sugar, the wheat products, and the seed oils, and see how that disappears. You don't need a surgery for that, do you? And then the weird part about this condition, the BPH, is it is actually said, from what I was just reading, that symptoms can come back again. And actually, BPH, let me just find if I can see, let me just see if I can find that and read it to you. That really caught my attention. That BPH can still come back. So therefore, you don't have to rely so much on those medications thinking that they will change your life. When I find that, let me see. It was a very large study, and I would love to just read that part for you if I get it. Meanwhile, you can throw in your questions so that I can answer them, and then we call it a night. And as usual, we feel appreciated that you're always here trying to learn something from us as we learn something from you. If there's any question on TikTok, kindly pass it forward so that I can answer it. My people on YouTube are so supportive. We appreciate you. And by the way, I'll keep on telling you that on the week that starts from 29th all the way, we'll have our weight loss program, and we are focusing on helping people lose weight. So you can join in. The contacts are literally all over. You can talk to Wasike so that we can get to add you into that group. And as 29th comes in, we can start that conversation in that program. Also, those people who are suffering from these chronic conditions and are within the environs of Nairobi, that same week, I will be in Nairobi, so you can check us out through the contact that I'll provide. Book that appointment so that we can have these conversations. And after that conversation, you will know that things can really change for you for the better. You don't have to be a slave. You do not have to be a slave to the healthcare system because you can do better. Is there any question for me? Let me see who is taking this question. I've not found that part. I would have read it to you so that you can understand what totally goes on. So they are telling you, even if you're taking these drugs, there's nothing that will change. Good, good. You have any questions concerning the topic of the day, kindly just put it here so that I can answer it and somebody else can actually learn from your question. Does sex suppress prostate cancer? Stanley, keeping a teach. This question, I always get it from somebody who, from people who appreciate sex like that much. When I talk about semen retention, everybody's like, oh, there's studies that say when you have, when you avoid sex, you'll end up getting prostate cancer. So this question is interesting. Does sex suppress prostate cancer? There is no link. You can be sure there's no link. And those people who actually have been having sex are the same people who end up having prostate cancer and stuff. But we'll talk about prostate cancer sometime. So listen to this. Cancer is actually fed by sugar and insulin and inflammatory foods. Sorry. So that has nothing to do with sex. The only case in an enlarged prostate is when you start getting into chronic masturbation and pornography, where you actually wear off your prostate and you keep overworking it. Remember, the prostate is producing actually the fluids that will join in the seminal fluids to just clear the way so that the sperm gets out clearly or in a healthy way. So they clear the way. They're the John the Baptist if you're a Christian. So they come clear the way for for the seed. But now, if you're working every hour, some people even have masturbation for 10 times a day, and they are overworking their prostates. And you can imagine, most of the research that is coming out about masturbation is actually in support of masturbation. So therefore, you can hardly find research or videos that are talking against masturbation, because if you put up a video that is talking against masturbation, of course, demonetization or it can be pulled down easily, because of course the system wants the man weak, sick, and depressed so that it can take full control over the society, because they know if they weaken the man, yeah, they have control. So there's no relationship between sex and prostate cancer. Can someone with colon cancer fast to better the condition? Cancer, everybody who has cancer, be it colon, be it prostate, be it any type of cancer, you need to fast and prolonged fast, because fasting will produce ketone bodies, and ketone bodies are the ones that actually suppress the cancer growth. Cancer cells rely on glucose. They love glucose. So if you deny them glucose through fasting, then of course they start to die. Okay, and also cancer spreads very fast through inflamed tissues. And those foods that cause inflammation in the system, the sugar, the wheat products, the seed oils, those are the foods that will actually mess you up. So therefore, if you are bright, you need to drop sugar and inflammatory food so that you clean inflammation from your system, and therefore you don't feed the cancer cells. And also you don't cause them to spread with a lot of ease, because inflammation causes them to spread so fast. Can diabetics fast? Everybody should fast. Everybody should fast. Diabetics should fast, but diabetics should have actually a stepwise way of fasting. Start by clean keto, just drop those carbohydrates, and then you can talk to your doctor to start dropping those drugs in a systematic way, because the reality is a diabetic who is on insulin cannot fast, because if they do, they will go into hypoglycemia, because insulin, the major side effect of insulin is hypoglycemia followed by weight gain. So if you start fasting when you're on insulin therapy, or when you're on glibenclamide, the sulfonylureas, drugs famously known as no gluc, those are drugs that take you into hypoglycemia. So if you take them, you will end up having problems of hypoglycemia. But yes, if you're diabetic and you want to recover from it, first talk to your doctor, Then start editing your diet, go into a strict keto diet, no carbohydrate diet. Then after that, as your blood sugar start to stabilize, you can go back to your doctor and have a review and start tapering those drugs down as you get clearer and clearer. And then go deeper into fasting and deeper into keto diets or the carnivore diets. I'm an advocate of that. What is the cause of itchy balls and a little pain on my right ball? And is it kind of soft? Now listen, symptoms like this, we cannot diagnose them online. The only thing you can do for yourself is to go to a hospital and get adequate attention. Okay, don't rely on online diagnosis. You need a physical examination. Is pork meat and fat okay? Yes, it is. Oti Jemo, it is. That is pork lard. Enjoy it. We see all the research that is coming out to just demonize saturated fats, and pork is one of the fats that pork fat is one of the fat that has been demonized. I even saw the video that they were putting pork meat under a microscope and was showing worms and stuff. But reality is it's a saturated fat. And I remember when we were growing up, they used to use pork fat to uh, our mothers used to use it to just apply on our skin so that they can chase away demons. Mm? So it's pork lard. It's part of the saturated fat. Is there any question on TikTok? From TikTok, sorry. Hi, Doc. I'm in a very, this is Peter Makumi, a very timely topic for us older guys. Thanks. The Kegel exercises, how useful are they? Kegel exercises, they strengthen the muscles of ejaculation, okay? The muscles that connect the erection muscles and, okay, there's a tissue, there's a muscle that connects the penis and the erectile muscles of the penis to the anus. You need to strengthen that through Kegel exercises. And also the other one is the hip thrust. So Kegels and hip thrust are very good for strengthening your erection. So keep doing it. Beatrice Apondi, watching from Mumias, niko na shida juu ya mguu upande wa nyuma. I can't stand or walk proper. Kindly help. We will do that. I will help you, but not on this live because this live is specifically for building the man and the manhood. So it's a BPH live. It's hard for us to address that. Good. Not unless there's any other question, I beg to call it a night. And so don't forget, let me put up a contact for the consultation. So if you're in Nairobi and its environs, the week that is coming up on 29th, all the way to 2nd of February, you can check us out. We have a conference that will perform that week, so kindly book your appointments through that number. Number two, we are running a weight loss journey or program from 29th also. I think it's starting on 28th. So you can easily call Wasike or reach out to Wasike's DMs for that conversation so that you can book a slot. And as we start this, we get to help you lose weight as you help us also to maintain our consistency. And then we also have social media platforms. On Facebook, I exist as Dr. Lewis Muchile. On Instagram, I'm Dr. Lewis Muchile. On TikTok, I'm Health and Wellness Sport, and I'm also Dr. Lewis Muchile. So you can definitely join into those platforms, and let's continue this conversation going. Join us, follow us, follow our pages, like our videos, share them widely on YouTube. We'll appreciate that. That's the only support you can give out to us. And if you get into our membership channels, we'll appreciate also that's the one form of support. If you send us super chats, again, God bless you. Those of you who support us through M-Pesa, those of you who support us through prayer, those of you who always worried about us and how we are talking about these things without worrying about the big pharma, we actually appreciate you. So prayer, financial, and any type of support will be appreciated. So thank you so much for tonight, and I hope you learned something from this. Don't be shy to share our lives and our videos to those relatives of yours who are actually going through these conditions. They need it. So be kind enough to share it with them. And we'll see you on Wednesday as we talk about another topic, interesting topics over and over again. So thank you so much for being here with us. We say shukron. Good night.